I'm going to talk about modelling excess mortality across England during a national pandemic. It was mid-March last year, and the first few COVID cases were being detected in the UK. In Public Health England, the health protection side was very quickly overwhelmed. There was a call for volunteers for support, essentially for people who had a bit of time to think. The team was just a mixture of statisticians, subject experts, and data scientists. In normal times, we don't really work together, and we came together in this process. So that was kind of the first aspect of collaboration. So we met with the incident director, and essentially her ask was, can you just help us understand deaths better? We decided to estimate excess mortality. We felt it was a very comprehensive measure of the impact of the pandemic. So excess deaths are the number of deaths over and above what you would expect in a given time period. Within this project, there are 4 aspects where collaboration was really important. Establishing the data flows, so making sure we could get the right data that we needed for this project, but also for other analysts in PHE, to develop the actual methodology of estimating excess deaths. There was also the side of presenting and communicating the outputs to the stakeholder in the best way. And then there was also building resilience in the team. Like it was such a fast pace during the last year. There was so much uncertainty about whether people would be available all the time, etc. So we needed to make sure that this project could continue despite what was going on around us. In terms of resilience, all the code underpinning this used principles of reproducible analytical pipelines, so others could pick it up quite easily, and we published all the code openly, so people outside of PHE can use it on their data sets too. We use open source software, which means there are no barriers to accessing those software. We version control it using Git and GitHub, and we do package management within the code. We use functional programming, so we can reuse bits of code throughout the project. It's heavily documented, and there's testing within it to make sure any changes in code upstream don't cause issues downstream. Finally, where we publish the reports, we have a way of contacting us. There's a kind of email us address on the report. And that way we're engaging with users on an ongoing basis. People have asked for how can we compare 2 different time periods, which has led to the interactivity of the report. We've had a lot of data requests, so we started to put the data with it. We've changed the subgroups that we contain in the report, and also the way that we do our cause of death analysis. There are ongoing challenges with the report, such as the length of the pandemic, making it quite a challenging question of what is an excess death. We're refining the model on an ongoing basis, and we're continuously looking for improved data sources too. Here's a link to the report, and thank you for listening.
In the Office for National Statistics, we were responsible for creating the COVID-19 infection survey, and we worked closely with a number of departments, including colleagues in Public Health England, who, as you've just heard from Seb, did such a great job with the excess mortality in England work. We were able to get the COVID infection survey up and running with the first results in just a week. This involved organising a massively large-scale survey with field work and lots of other quite complicating factors. We were only able to do this because of collaboration. In terms of other government departments, in addition to Public Health England, we worked with the Cabinet Office, closely with the Department for Health and Social Care for very obvious reasons, Department for Education, and we also collaborated outside of government. That crucial role with the academics, that partnership, particularly from Oxford University and expertise from the University of Manchester, hugely important partners. And also other organisations such as the Wellcome Trust, IQVIA, and a number of others. It's impossible just to list them all. I can't think of another example off the top of my head from ONS that has involved quite the amount of academic and expert involvement to the COVID infection survey. So user feedback has described the survey as the jewel in the crown of the UK response to COVID-19, with the results informing key government decisions that have impacted every person in the UK. And that's a big responsibility. There have been many instances where people have been working long, hard hours over weekends till 2 o'clock in the morning, just so that we can meet particular deadlines. What we've found within our short time scale is we have the expertise, we've got the adequate resource there, and if a model runs smoothly, that's absolutely fine. But we do get glitches. There might be something that appears where a model hasn't quite run this the right way. There might be something in the data that makes us a bit suspicious, so we want to do some additional quality checks. So it's all these additional things that aren't really built into a normal working day. So it's blood, sweat and tears, really, for how we have managed to produce the data so quickly like that. I think collaboration in relation to COVID is not as tricky as perhaps collaboration is on other topics. I think there's just a combined sense of wanting life to get back to normal, people wanting to get married again, no lockdown restrictions, being able to go on holidays, visit relatives and so on. So it's not, in that case, COVID is sort of a high priority across pretty much every organisation in some respect. So it's that whole sort of sense of when you're collaborating and you're setting up a new arrangement with a partner or someone you want to collaborate with, if you've got that shared goal, the shared vision, and people can sort of bring their own strengths, different organisations can bring their own expertise and knowledge, having that shared goal really, really helps. And I think that achieving that has been relatively easy with COVID, because you're not up against people who, are enjoying COVID and want it to continue. Everyone has that shared aim in wanting to understand the pandemic, being able to measure the pandemic and help inform decisions in the response so that the whole country can sort of get back to normal as soon as possible. So I think that's really helped, that shared vision.